Today is Thursday, April 18th, and I'm going to be talking a little bit more about exercise. As I mentioned in my last video, exercise is important. It's something I feel comfortable with, but I want to first go into the whys for exercise. Obviously, exercise helps us lose weight, but as I go into surgery, exercise is a means of preparing my body, my mind, my spirit for it's an intensive experience. Also, exercise very important for the post recovery of surgery. And as I lead up into the weeks now, about 6 weeks going to surgery, I'm exercising every day. And let me explain what that means. We have to meet our bodies where they're at. And normally I was quite active. Many of you know I was riding road cycling about 30 or 40 miles a day, about 5 or 6 days a week. Clearly that is not possible. The fibroid is quite heavy. It's very similar to being about 20 weeks pregnant, and it's just too much for me to sit on the saddle, which is the bike seat, and just too much pressure leaning forward. So I've had to adjust my exercise to where my body is at this moment. Will it always be like that? Probably not, but for now I'm going to do what I can. So as I mentioned, walking is a really great activity for me. I move kind of fast. I've been increasing the length, the mileage that I walk progressively over the last couple months. Even before I knew I had this surgery, walking was something really good. I continue with my yoga. Though I don't consider yoga exercise, it is a mind-body pursuit, so clearly the body's involved in it. But the yoga is definitely has changed. I used to have a very vigorous, almost hatha flow practice, quite strong, and I've had to pull back. My body, as I mentioned before, is like being close to 20 weeks pregnant, so it's the fibroids are very heavy, and I do risk hurting my abdominal wall, hernia. It hurts the joints, and there's no sense in overdoing it. So right now, walking is a great activity. I have been in the pool a few times. The buoyancy is wonderful. It actually takes a lot of strain off my back and the joints of my hips. Makes my shoulders feel better. I think because I'm so tense, my shoulders are lifted. So finding the right exercise is very important. As I mentioned, I've been walking, kind of adding. I'm thinking about running a little bit, doing short little spurts to get my heart rate up. The heart is a muscle. All my muscles need to prepare for this. And after surgery, post-surgery, trying to flush out excess fluids that build up as a result of the incision and just the different medications they use within the body. Very important that my muscles are working optimally, as well as the lungs. They get you up and moving pretty quickly. As soon as the epidural, the spinal wears off, I know I'll be up and moving, which is really good. But that's to get the lungs going. The more you are sedentary after surgery, it's not great. So going into surgery to optimize the performance of my lungs, I am pushing myself a little bit walking, trying to do a little bit faster every time I go out, timing myself, maybe go a little bit longer. Like I said, I'm going to do a little walk, run in between. I don't know how that'll work out. I'm kind of nervous that it might be a little bit too jarring, but if it is, I'll pull back. And swimming, anything to get a sweat up. I mentioned before, yoga to me is not exercise, though it does benefit the body. So I've been doing pranayama. There's lots of different techniques, which I will not get into in this video. Again, pranayama, you have to practice it under an experienced teacher. So this video is too short for me to explain the type of pranayama I do, but it's a faster type of breathing, Bhastrika, to really force my lungs to work a little bit harder, get a little bit of sweat for like Kapalabhati, and doing those kind of things. So though weight loss is important and exercise is great with that, that is really not my ultimate goal. Trying to keep my weight. If I lose a few pounds, wonderful. That always helps going into surgery. But mostly for the systems of my body. Digestion is another important one. Trying to keep my digestion very stable. That's very difficult right now. The size of the fibroid, the mass that's in there, obviously has a tendency to slow my constitution. So as I walk every morning, my body is becoming habituated to having regular movements, and therefore I can eat healthy and maintain my weight, or if not, just lose a little bit. So the nutrition that I'm getting in is much better. As far as the benefits mentally, the focus is important. It gives me an opportunity to stop and just look around and focus on something other than the pain or the discomfort or the worry or the anxiety, the fear of going into surgery. And so I sleep much better. I tendency to wake up in the middle of the night and get very tired. So that little bit of walking in the evening, if I can walk, I try not to overdo it because that will kind of keep you awake. And so I avoid that. Some people have asked me if I'm lifting. I am staying away from that. The mass is so big that any kind of lifting puts pressure down in my pelvic area. And I am very nervous about prolapse at this point. So I'm not lifting. I'm just doing what I can. As I mentioned, the walking, the swimming, the pranayama. I am continuing to do some restorative yoga postures. I practice for about 20 minutes, typically towards the evening, just as a position to kind of release any tension in my hips, my low back. My abdomen has tendency to get quite sore, and as I mentioned, my shoulders. So restorative is a great way to just sort of relax over bolsters or other types of props. And naturally, as the body just kind of eases itself into a state of being still, the joints, they kind of release, the muscles kind of unbind their tension. So restorative is a great restful practice, which I consider is an exercise on the opposite end of the spectrum. So when my joints feel better, my muscles, when I do walk or just try to function during the day, I'm not as fatigued, and that's really important. So that's all I have to say really about exercise. As I kind of travel through these next few weeks, I will give you more updates, and got to put my walking shoes on. It's early in the morning, about 6ish, and I'm getting my walk on. So I will check in with you all real soon. Thank you.